Practical Nursing students. My name is Darlene Lopresto and I'm an instructor here at Jackson College, and today we're going to talk about oral, ophthalmic, and otic medication administration. So we have here our medication administration dispensing cart, and we're going to talk about the 6 rights of medication administration. So please be sure that you are practicing and memorizing those. You're going to need to know those for the rest of your life. We're going to take some medication and we're going to walk through this 3 times that you verify that your patient's medications are correct, because that's one of the ways that we prevent medication errors. So I have with me my medication administration record, and I'm going to go to my dispensing center and obtain my patient's medications. I also have with me my medication tracking sheet. Again, you guys are supposed to be filling these out so that you understand what medications are that you're passing. You don't want to give any medication if you don't know what they are. So we're going to go to the administration cart first, and I'm going to be looking at my medication record, and I'm going to pull all of these out of the cart. Now every place that you go is going to be a little different. They may have an electronic system. The one that we have at the hospital where I work has a fingerprint model on it, and that's how you get into the system. And then some of the nursing homes have like a cart like this, and they're double locked. So it just depends on what facility you go to. So you have your medication record. And so we're going to pull a couple of this gentleman's medications. So we have some oral. This is furosemide, 40 milligrams. And he's going to get an injection of morphine. And then he also has some eye drops ordered. Tymoptic. Okay. So that's my first check. I've got my MAR, I've pulled it from the machine, and I've verified, yes, these are what I want. Now, it may ask you to scan the medications at this point in time. Again, it depends on what type of machinery they're using. Now, the next step is I need to do my second verification when I'm preparing these medications. So I'm going to set these down with my MAR because I have several things I need to prepare. And I'm going to just get rid of my cart. All right, so the first thing I have, and let's do some hand hygiene. The first thing I have is what's called a Carpiject. This is a Carpiject. Sometimes medications like narcotics come in a pre-filled syringe. This is saline. And so we have to place it in the Carpiject. That's how we administer it. And it just snaps into place, and then it screws onto the bottom of the plunger. So we're ready for that. I've got alcohol in my pocket, and again, I'm double checking that I am giving this medication. All right. And now I've got my eye drops. Now with the eye drops, remember, you're going to keep the tip of it sterile. You're not going to touch the inner eyelid at all, and you're going to put it right in the middle of the conjunctiva, so you'll pull the eyelid down and drop it in sterilely, just 1 or 2 drops, whatever's ordered. So again, we have to double check, make sure that we have Tymoptic, and it's 1 drop in each eye twice a day. All right, so I'm going to take that with me to the bedside. And lastly, I have some Lasix, also called furosemide, 40 milligrams. This is 40 milligrams. This is how they're packaged in a nursing home. It's called a punch pack. And this will last about a month, depending on how many times a day it's ordered. And you take your medicine cup and you just punch the medication out, of the packet, like that, and then you're ready to give it. Now, we're going to take all this with us to the patient's room. Knock, knock, knock. Hello, Mr. Jones. How are you today? Good. My name's Darlene Lopresto. I'm the nursing instructor at Jackson College. I have some medications to give you that the doctor has ordered. Hand hygiene. Can you tell me your name and date of birth? I need to check that on your armband. Okay, good. All right. How about any allergies? None? Okay. Let me tell you what we have for you today. We have Lasix, which is furosemide, 40 milligrams. Once you take that at home, okay, we have that, and I have it ready in the cup for you. And then we have your Tomoptic eye drops, 1 drop in both eyes twice a day. Okay. And then I have your pain medication, and it's Norco, 5 milligrams intramuscular. Yep. Okay, good. And it looks like the last time you had it, it's been over 6 hours, so it's definitely time to give it to you again. All right, very good. Now at this point in time, you would, we've double checked his armband, so if we need to give the injection, we'll put our gloves on, especially with the eye drops too. Remember with eye drops, if it's anything other than saline, you're going to want to cover the lacrimal duct because you don't want the effects to go systemic. So again, just review all of the different nuances of oral, ophthalmic, and otic. I don't have the eardrops here with me. Review your injections. Some places will have a scan, and at this point we would scan the patient's medications and we would scan their armband with a computer system, and that's a really nice way to make sure, again, we have the right medication with the right patient. So remember those 6 rights of medication administration. Memorize those and continuously go through those in your mind as you're passing medications. Of course, we'll be there with you to help you do that. I think that's all we need to talk about for this video. Thanks so much.